Nausea is the feeling of discomfort in the stomach, usually followed by an urge to vomit or throw up. Many things can cause nausea and vomiting, including chemotherapy, supportive medications like antibiotics or antifungals, pain medications, total body irradiation, solid tumors in the body, or anxiety. Nausea and vomiting can cause a reduced ability to eat and an increased loss of nutrients that can lead to malnutrition. Preventing nausea and vomiting is key to preventing malnutrition and its negative impact on your recovery. Tell your healthcare team right away if you are experiencing nausea and vomiting. Antiemetics are medications that can help to target different triggers of nausea and vomiting. Your healthcare team can help to determine what medications may be most helpful during this time. Taking antiemetics, as they are prescribed by a team, is important in the management of nausea and vomiting. Let your healthcare team know if you cannot afford the cost of these medications. Changes to your diet can also help to decrease nausea and vomiting. It is important to determine what foods work best for you, which can involve trial and error. For example, the smell of hot food might trigger nausea and vomiting, so try cold foods or room temperature foods might be easier to eat. The following tips might help to decrease nausea and vomiting. Try to eat small, frequent meals instead of 3 large meals daily. The dietitian can help to provide snacks in between meals for you in the hospital, which might be easier on your stomach. Try to eat foods that are cold or at room temperature if the smell of hot foods triggers nausea and vomiting. Try to eat bland foods if the smell of highly flavored foods triggers nausea and vomiting. Examples: try pita bread, plain roti, rice, plain crackers, plain noodles, or pasta. Sip on fluids between meals or snacks. Your body loses fluids when you vomit, and if you lose more than you can drink, you may become dehydrated. Try drinking or eating chilled, nourishing fluids such as smoothies, milkshakes, yogurt, frozen desserts, ready-made drinks like Boost or Ensure, poured over or blended with ice, popsicles, frozen dessert bars, or sports drinks. Avoid eating your favorite foods when you're nauseated, as you may lose your desire to eat them when you're feeling better. Separate fluids from solids during meals so you do not fill up on low-calorie foods. Eat foods that have not triggered nausea and vomiting for you in the past. Try to relax during meals and chew food slowly. Try to wait at least 1 hour after you eat before you lie down. Avoid alcohol and caffeine, as they can draw more fluid out of the body. Talk to your healthcare team if you feel anxious about eating, as this can also trigger nausea and vomiting.